Hey.
Come on in to Simulation Labs.
Thanks.
Hey Kelly, how are you today?
Good, thanks. How are you?
Yeah, good.
So what are you studying?
I'm studying Bachelor of Nursing at CSU.
What year are you in?
Second year, second session.
What are you doing right now?
I've got a patient here with pneumonia and sepsis, so I'm just going to do a blood pressure on him.
So when you say patient, do you mean the mannequin?
I sure do.
So what are they about? How do they work?
Well, we have a simulation pad and our teachers and our student coordinators set them up so we can have abnormal or normal vital signs, so normal blood pressures and heart rates, or we can have abnormal sounds in the lungs like crackles and wheezing, so if they have COPD or pneumonia we can pick that up.
So what was his blood pressure like?
It's 110 on 70 and that's a bit low, so I'll just have to prep and prime an antibiotic for him.
What's happening at this station?
So I'm looking after a palliative care patient who's just receiving some end-of-life care. And I'm just going to insert a subcutaneous line into the patient's abdomen.
Are you in your second year too?
Yeah, I'm also a second year student, although it's only my first year of studying here on campus.
How does that work?
Well, I actually came through university as an enrolled nurse, so it's a pathway into university.
So you studied enrolled nursing and then switched across?
I did study enrolled nursing, so I'm currently as an enrolled nurse, and then that gives you the credits for your first year of first year subjects, and then you just come straight into your second year.
So can you talk us through what you're doing?
So I'm just going to give this patient a subcutaneous line into his abdomen. So it's often used in palliative care patients so that we can administer medications without having to continually give injections to a patient. So this catheter actually can stay in the patient for up to 7 days. So I'll just get all the area all ready. It's a little bit more comfortable for the patient. So I'll just gain some consent off the patient. I've already spoke to Seeth before. So Seeth, this is just the needle I was telling you about that we're going to put into your abdomen. Are you still okay with that? Yeah, beautiful.
How realistic are the mannequins?
The mannequins are really good. Like, they give you the experience of being able to practice all your skills that you'll learn and then utilise that in the placement. And it's a safe environment to make mistakes with the teacher's support.
Have you done a placement?
I have done a placement. I've done my first placement at one of the local hospitals, and it was for chronic and complex.
And what was that like?
It was fantastic. So all the skills that you've learnt throughout the semester, through the first and second semester, you're then able to then go and be buddied up with an RN and practice those skills then, and just build upon the skills that you've learned here while you're here at university. So it's been really good. So this is the subcutaneous needle, and so it just gets inserted into the patient's abdomen. All right, little sharper now, in we go. So straight into subcutaneous fat there.
So how's the antibiotic prep?
I've just flushed the line and I've primed and prepped the IV antibiotics for the patient. I've got consent off Seth and I've done the 6 medication rights.
Have you done placements as well?
I have. I've done a placement here in Bathurst in community health, and I've also done a placement here in surgical ward, and I've done a community placement in mental health in the ACT.
What was that like?
I really enjoyed it. I already work in mental health and it just solidified my passion to do mental health when I finished my nursing.
So what is mental health nursing about? What do you do?
It's about doing mental state examinations, finding out what mental illness the person might actually be suffering from, and then finding ways to treat and manage the mental illness.
So why did you pick CSU?
There's smaller classes, so you have the opportunity to liaise with the teachers better than if there were big classes. And also the simulation labs gives us a lot of experience.
Well, it looks like you got your hands full. We might show ourselves out.
Okay, thank you.
Thank
Bye.
you.
Bye.